What barriers exist in pet healthcare for rural pet owners in the future? Breaking news for pet owners in rural areas. The question on many minds right now is, what barriers exist in pet healthcare for rural pet owners in the future? As veterinary medicine continues to advance, rural pet owners may face unique challenges that impact their access to quality care. If you are searching for ways to ensure your pet receives the best health care, this information is for you. First, many rural areas struggle with limited veterinary infrastructure. A recent report shows that only about 35% of townships in developing regions have access to full-service veterinary laboratories. This lack of facilities restricts the availability of advanced diagnostic tests and treatments. Next, the high costs of advanced diagnostics can create significant hurdles. Although technology has made some tests cheaper, premium molecular diagnostic kits still cost 3 to 5 times more than traditional tests. Many rural veterinary practices operate on tight budgets, making it hard for them to invest in new technologies. Geographic and socioeconomic disparities further complicate the situation. Research indicates that rural patients, including pets, are less likely to access advanced imaging and diagnostics compared to their urban counterparts. Geographic distance, transportation issues, and lower income levels all contribute to this challenge. Another issue is the underutilization of veterinary support staff. Inconsistent professional regulations have led to many veterinary nurses and technicians being underused. This can reduce the efficiency and quality of care, especially in rural clinics. Even when advanced tests are available, interpreting the results can be difficult. Veterinarians may lack the necessary clinical data to make informed decisions, which can discourage the use of these tests in rural settings. Rapid mutation of veterinary pathogens is also a concern. This requires constant updates to diagnostic tests, which can delay their availability during outbreaks. Rural areas may experience longer wait times due to supply chain and resource constraints. Lastly, limited access to proactive wellness services is a growing issue. The trend toward preventive screenings and health monitoring relies on technology and regular veterinary visits. Rural pet owners may find it harder to access these services, impacting early detection and prevention of chronic conditions. In summary, rural pet owners face ongoing barriers related to infrastructure, costs, geographic isolation, workforce limitations, and evolving veterinary technologies. Expanding online veterinary consultations and virtual pet care services could help bridge some of these gaps. By providing remote access to expert advice and monitoring, quality pet healthcare can become more reachable for rural communities.